keep turning.
Americans are living longer and their numbers are growing.
For the first time in our nation's history, we will have more older people than we will young children.
Recent data from the U.S. Census Bureau found that the population of people aged 65 and older in the country grew from 12.4% in 2004 to 18% in 2024, and the number of older adults outnumbered children in nearly all of Ohio. As the state's population ages, the state is facing a demographic reckoning. John Bulbus is a long-term care scholar at Miami University.
It's really two big problems. One, how do we pay for this? But number two, do we have the workers to care for those individuals when they need it? 2.2
million Ohioans are 65 years or older. Like other states, Ohio is struggling to find a workforce who wants to care for the elderly, says Ursel McElroy, director of the Department of Aging.
Most would acknowledge that the staffing levels in nursing facilities in Ohio, and as I mentioned across this country, are not optimal.
Pay is a major issue. The median hourly wage for a registered nurse in 2018 was $33.41. In 2021, it was $38.93, according to a Miami University study.
If you don't pay enough money, you can't hire nurses, and generally speaking, there is an association between nursing staff levels and the quality of care that's being provided.
Brandon Boyd is a certified senior advisor that helps families navigate senior living options.
The government's going to have to step up to provide these caregivers. I think pay is a big potential because a lot of them are paid, almost like minimum wage workers like McDonald's, but they're offering a great service to our seniors.
According to the U.S. Bureau of Labor Statistics, in May of 2024, the average base salary for home health and personal care aides was $16.82 per hour. In comparison, fast food and counter workers earned an average of $15.07 per hour. Harvard Public Health projects that the care worker gap will reach 4.6 million unfilled jobs by 2032. Driven by soaring demand for home care workers and persistent industry turmoil due to high turnover, low pay, and reimbursement issues. The director of the Ohio Department of Aging says financial incentives to encourage people into the elder care profession do work sometimes.
We have competing businesses that come in that perhaps can offer an equal or higher wage.
A confluence of problems is hitting Ohio as the population ages. Not enough workers, a fast-growing aging population, and the rising cost of care are being addressed.
This is not a problem that one singular agency can handle. This is an issue that is for the entire state to address.
How do we try to care for people in the setting that they prefer the most, which is probably their home, which only is exacerbated by the two issues of we need more workers for that, and then there's how do we pay for that?
For the 26 budget, I'm happy to report within the aging space, we did not see any cuts to our provider rates, and that is huge.
According to the U.S. Bureau of Labor Statistics, the prices for senior care services are rising faster than the price of inflation. In September, the Consumer Price Index rose 3% a year, while prices for nursing homes and adult care services rose more than 4% over the same period.
The cost of operating those facilities have gone up, and Medicaid hasn't covered the cost.
When it comes to senior living, Medicare reimbursements really don't come into play much. So Medicare is more for health issues, but if someone needs just like help going to the restroom or help bathing, typically Medicare won't pick that up.
While Ohio has several programs to allow people to age in their home instead of a nursing home, the programs aren't widely known.
Does the state need to do a better job to let people know that these programs are available so they don't feel alone?
Absolutely. And I agree with you, and we are absolutely committed to that.
The business of elder care faces other major challenges. Abuse continues to be a problem, according to state statistics. In 2020, the Ohio Department of Jobs and Family Services received more than 32,000 reports of abuse, neglect, or exploitation of Ohioans aged 60 or older.
With elder abuse cases, it is one of the most perplexing things that we have to deal with. One, it is often very underreported.
In 2022, Ohio lawmakers passed Esther's Law to allow for cameras inside the room of a nursing home to capture abuse that may otherwise go unnoticed.
Esther's Law was a very important piece of legislation.
But issues arose with some nursing homes that did not allow cameras for a variety of reasons.
We have received reports through our state long-term care ombudsman that there have been some difficulties in certain parts of the state and in certain facilities in particular where perhaps maybe it was cost prohibitive or maybe they didn't get the consent they needed to be able to have the cameras placed. And when we learn about that and have concerns there's a barrier, we do respond quite quickly and pretty sternly.
Ohio State's Plan on Aging, which runs through next year, has a goal for older Ohioans to live healthier.
We have to begin at a much earlier age. We have to have healthier practices so that we can focus on health and not just disease.
The director says beyond creating healthier lifestyles, it's also about pushing for greater education.
This is not a problem that one singular agency can handle. This is an issue that is for the entire state to address and to address it well.
She says that means that families need to understand the signs their loved ones may be in failing health and addressing safety issues in the home to make it safer for them to live there to avoid expensive medical treatment.
Things that help a person safely take a shower or bathe, or if I could have a ramp on a home. That goes so far in perhaps preventing something like a fall. And we know that a fall is sort of a precipitous event. Once that fall happens, that person now perhaps has rehabilitation, a long recovery, and perhaps they won't recover to the person they were before.
I think the state is doing an okay job. I think it's something that a lot of people just don't think about or they don't want to think about. Nobody wants to think about the time when their loved one can't wipe their by themselves, and that's not a pleasant thought. So a lot of people delay thinking about it until they're confronted with it, and then they're overwhelmed and making a lot of decisions in a quick time frame. So I think it's part of it is just letting people know it's okay. This is almost inevitable. These things happen as you age. It's part of the natural aging process. It's nothing to be ashamed of, but these are the surfaces out here to help you take care of that.
Thanks to modern medicine, Ohioans are living longer. According to this Miami University study, the fastest growing segment is those 85 years or older, which is expected to increase 52% by the year 2040, or 19.2 million Ohioans. If that group can't age in place, they'll need more places to live.
In Central Ohio alone, there's over 200 senior living options. So between assisted living, memory care, skilled nursing, and independent living, there's over 200 options. So there's a lot of options. Are there enough of them? No, I don't think so. So I think there's going to have to be a big investment. Private companies, government funded are going to have to come in and build more. I think there's a danger with aging in place, and that sometimes it can mean isolation, and loneliness and isolation can be a big. It happened to my grandmother. She was very lonely after my grandfather died, and we tried to keep her at home because we thought that was the best option for her. But in retrospect, I don't think that it was. And so some more education about what assisted living truly is and how it differs from skilled nursing, and that these are senior apartments. Yes, they can decorate them however they want. But this is your private space. You just have somebody come in and clean. Once a week. You have somebody to bathe you if need be. You have somebody to cook all your meals. So just educating on what they truly are and showing the benefits of those. And I think, to me, one of the best things I did recently was actually toured my dad with one. I said, "Dad, can you come with me to tour this assisted living community?" And he was kind of reluctant. He didn't really understand why, but because in his mind, he knew what a nursing home was, but he didn't know what this in-between level of care was. And so aging in place is good, but to a certain point, I think you just have to be careful. Some people, that's like, of course, that's where you want to start, is to age where you're at right now. But there is a point in time where you have to ask yourself, families have to ask themselves, is it time to move? Because aging in place can be very isolating, particularly if you can't drive anymore, you can't navigate up and down stairs anymore.
Experts say families need to understand if they do qualify for Medicaid, it's not free. That money has to be paid back under the state's Medicaid estate recovery law.
Medicaid definitely is not free. We got hit with that with my grandmother. She had 3 houses, and we ended up having to sell all of them to pay for her care. And she was in skilled nursing for a while, and it wasn't a very good facility, and she really didn't need that level of care, but they didn't tell us, and so we wasted probably over $100,000 by having her at an inappropriate level of care, and yeah, and she really died penniless.